here and online, I think we're going to go ahead and get started. For those of you who don't know me, I'm Pam Coons. I am the director of the GI Cancer Program, but this talk has nothing to do with that. So you are in the right place if you're here to hear for Dr. Bedzow and to talk about ethics. So Dr. Ira Bedzow is the executive director of the Emory Purpose Project, whose mission is to unite diverse partners across the Emory community in providing opportunities for students to develop a muscle for reflection on purpose and meaning. He's also an associate professor in the Department of Medicine and a core faculty member of Emory's Center for Ethics, a senior fellow in the Center for the Study of Law and Religion, and the unit head of the International Chair in Bioethics at Emory University. His interests relate to understanding the ethical implications of biotechnology and healthcare policy, as well as how organizations can create an ethical culture through values-driven leadership. Ira tries to show that making a values-driven decision and implementing it effectively consist of different skills and face different challenges. And understanding the difference between asking what to do and how I can act on my values successfully is key to leadership and organizational success. So I met Ira last year through the ASCO Ethical Leadership Program, not really knowing what that meant or what it was. Ira is provocative, engaging, entertaining. I think this will be a really just thoughtful, enjoyable presentation this morning. He will really challenge you to think deeply about what it is, what ethics are, and how we can look through that lens in healthcare. So thank you for being with us today.
No, thank you, Pam. I wanted to be a stand-up comic, but no one, I mean, I thought I was hilarious, but no one else thought I was funny. So instead I went into this. But in all seriousness, among the things that I do, one of them is building ethical leadership programs. So instead of talking simply about like what are the skills of ethical leadership, which we might get into, or why ethical leadership is important, which I hope you think it is, what I actually wanted to do today was kind of show you how the sausage was made. Meaning like I'm going to go and tell you what I think about what is needed as a background to create ethical leadership programs, such that people can develop the skills, both the skills in terms of ethical competencies and also in leadership competencies. So what I'm hoping to do first, before we do anything, is define the challenge. Because if there's no need, then I shouldn't be here, right? So we're going to try and justify what the need is. Then I'll define what ethical leadership is, because it's always good to define your terms. If you don't define your terms, then people have no idea what you're speaking about, and this would not be a success. Then I'll provide a theoretical background for ethics and leadership development, and then I'll provide a framework for that type of curriculum. Sound good? Okay, so but here's the challenge. So just a little bit of background. Pam told you that I ran ASCO, which was the ASCO Ethical Leadership Program that was built on something that I work with, or I created with Matt Winnie, called the Aspen Ethical Leadership Program. And after our program this September, we put out that CME survey, and we asked which competency areas did the attendees feel as if they improved as a result of the activity. So if you look at them, their patient care, professionalism, informatics, I'm not going to go all the way through. My first question here is, does medical ethics training inform these competencies? Oh, that's not rhetorical. Like, not until they are applied. What does that mean? Meaning like you learn ethics theory and then you have to apply them? Got it. So, right. Okay. So from what I'm hearing, my understanding is when you think about what you're learning in terms of medical ethics, you're learning about norms, values, and principles, but it doesn't really have any relevance until you yourself can apply them, meaning you're not learning its application in the class. That's something that you have to learn on your own. Right. Okay. One of the other things that I've noticed in terms of medical ethics training is a lot of times medical ethics training will speak to the clinical environment. Right? Like even principalism itself is, how are we acting in a professional way given the patient-physician or patient-clinician relationship? right? When you look at these competencies, each of these competencies relate to the clinical work you'll do, but they're all factors in the organizational ethos of the hospital, right? So when you're thinking about not simply just theory versus applicability or practicality, but when you're thinking about how a particular instance in the clinical environment is impacted by organizational policies, organizational habits, and organizational expectations, right? That's another leap that leaders have to make, right? So we're gonna talk about not only what clinical ethics looks like, but how clinical ethics is informed at the organizational level through ethical leadership. So here's the next part of the challenge. So when I went to ASCO, it was a two-part program. The first part, we provided the cases for discussion. The second part of the program, a couple months later, we asked the ASCO participants to create the cases that they wanted to talk about because they were relevant to them. So here are the cases that they came up with. There was who decides what is legitimate medical care, gender discrimination and harassment, cognitive overload, which speaks partly about scopes of practice, partly about having too many patients in too little time, partly about just the sense of burnout and sometimes moral injury, and then working from home. Now, are these cases medical ethics cases? Are these cases ethics questions? I'm sorry. Oh, because I'm here, you're going to be like, I have to be, Ira. You're the one who's saying that. Ooh, you can give a twist. It's like having, what is it? It's like having a Diet Coke, like a little twist of lemon. It's like, these are a real challenge with a little twist of ethics. So maybe what I'll do is now that like I've set up the challenge, I'll define my terms and hopefully convince you that these are deeply ethical questions based on not only the substance or the content of the challenge, but also the manner in which we can think about them, right? So, all right. So what is ethics, right? Like we're going to go, what is an ethical leadership? We'll define ethics, we'll define leadership, we'll put it together, and then we'll keep going. So one definition of ethics, which I'm sure that you've seen before, is ethics is concerned with or relating to what is right and wrong or good and bad in human behavior. By the way, why did I put right and wrong and good and bad? Is there a difference between those things? Or am I just trying to say, I know a lot of words? I mean, I might be. I do know a lot of words. I mean, not to brag, but I have dictionaries. What's the difference between right and wrong, good and bad?
Right things that are good for some people, but bad for other people. Wrong things that are good and bad.
Yeah, so I'll say it a little bit differently. Right and wrong speaks to the process, right? Good and bad speaks to the consequence, right? So, because I mean, you could do the right thing with bad consequences. You can end up getting good consequences, but still doing the wrong thing, right? We'll get to relativity. Yeah, but at this point, I want to at least just start defining my terms and then go through it. So, given your question, I get this in a general way, like it's a good conceptual definition, but like, what does that even mean? It's operationally problematic, either because of relativity, right? Meaning like, who's defining right and wrong? Who's defining good and bad? Or about operationality, meaning like, okay, even if we can agree what the right thing is, we're talking about it, but what does that mean in terms of actually actualizing it? What are we doing here, right? Are we just talking, or are we learning in our class theories, norms, and values, and then we have to gain our own experience to fumble through how to implement, right? So let's think about another definition. The other definition is concerned with or relating to how a person or a community's goals and values connect with their behavior. Okay, that seems a little bit better, meaning like, I know what my goals are, I know what my values are. We have organizational mission and values, and we want to make sure that our practices, our habits, and our policies connect to that. Like that sounds pretty good operationally, right? That's conceptually problematic. Why is it conceptually problematic? Well, how do we know if our goals and values are the ones that we want to have? Right? Like, how are we defining our terms? Right? We already like spent a couple minutes, seconds, thinking about the relationship between good and bad and right and wrong. I'm sure the words that we use for goals and values also need to figure out, like, are we describing this well? right? So then we're stuck. We can create conceptual definitions, which are operationally problematic. We can create operational definitions which tell us how to do it, which are conceptually problematic. Like what's left? Do I go to the next slide? Or you're like, I know. No, okay, fine. What's left? So what I like to do is I like to think about a definition through a series of questions, right? So the questions that I'll usually ask either individuals or companies or organizations or leaders is, first, given a situation, what do you want to do, right? And then I'll ask, what do you want to do that thing? Now, what does that mean? That seems like a lot of wants, right? Do you know the difference between wanting to do something and wanting to want to do it? Would you like to give you, let me give you an example just because, again, another opportunity for a joke. There are times when I want to be the type of person that eats healthy and, doesn't diet, but like has a nice like way of like eating habits. I also really love cheesecake and want to eat cheesecake when I see it, right? So now when I'm presented with cheesecake, will want to eat it, but I also want to be the type of person that can restrain themselves every time cheesecake is presented in front of me. I know this sounds crazy, but it's, I think, a good example, right? So I am now in conflict between what I want and what I want to want. I want to not want to eat it. So hard, right? So now I can either not eat it out of compliance or reevaluate my higher order and lower order desires. So that's what I mean by, do you want this? Do you want to want this? The third is, what does this tell me about myself? Right? Because it's like ethics is not simply a matter of actions that are, just atomized or alienated from the next one. Actions add over time or integrate over time to an identity, right? So wanting to want these things, meaning what are my values or higher order beliefs or motivations, the wants that I do in terms of the action should speak or say something about who I am or who the organization is as an entity. Then, again, higher order, is this the type of person or is this the type of organization that I want to be, right? And then how do I achieve my wants effectively? Now, I'm hoping someone will ask me the question of, wait a minute, I thought ethics was about oughts and shoulds, not about wants. What is happening here? So does someone want to ask me that? I'll ask myself. I thought ethics was about oughts and shoulds, not about wants. What is happening here? So why am I using wants as opposed to ethics should be what ought I do in this situation? What does this say about me? How can I achieve my oughts effectively? Why am I talking about want? Ooh, tough crowd. So I will tell you. When you hear either another person tell you or you tell yourself, I ought to do something, what does that do for you? It doesn't motivate at all, and it's not honest. What you're doing is you're objectifying yourself to then coerce yourself to do something. But if you're honest with yourself and say, do I want to do this? And then reflect on, wait, do I actually want to do this? Like, does this say, is this really the type of person that I want to be? What does this mean if I'm the type of person who has these types of wants and wants to carry it out this way? Then you're speaking about motivation and you're speaking about self-reflection as opposed to compliance and coercion, right? It's just more persuasive, right? And forget about all the background in terms of extrinsic and intrinsic motivation. Forget all the background about is oughts even possible philosophically. Like, I don't want to get into that. But from the view of like, how can I be really effective in achieving something, both in terms of the self-reflection part and in the terms of implementation part, talking about wants is just more honest and more effective, right? So that's the approach that I'm taking here in terms of defining ethics. And here, by the way, you see how it solves the operational and it solves the conceptual problem, right? Because what I want to do speaks to your goals and values, right? Do I want to want those things? Speak to, are those the types of goals and values that I believe I should have, right? On the operational side is, how can I achieve my wants effectively? This happens all the time. I love when this happens. When someone says, oh, I ought to do something, the first thing they posture at in terms of implementation is, I ought to do this, so I'm going to try to do this, but because it's an external ought, the result is also external. So as long as I try, I covered my basis, and if it doesn't happen, it's not on me. Right? Have you guys ever had that sense? Yeah. But if you want to achieve something and you try and you don't get it, what usually happens? You'll try another way because you really want it, right? So the how I can achieve my wants effectively not only speak to the motivation of it, but it also speaks to the creativity of implementation, right? All right, so now let's go to, okay, what we talked about on the personal side. Let's talk about like mapping this out in terms of ethics. And this is a very complicated slide. It looks easy. I'm sorry. I'm not going to go through all of it. But if you want to think about ethics in this way, you want to think about its relationship to other fields of inquiry, or how I look at it is into other fields of inquiry. I look at it in terms of what's the relationship between the theoretical and the practical, and what's the relationship between the individual and the societal, communal, organizational, right? So, and if you also think about it, the baseline, the fundamental questions on the individual side is what's the foundation of human choice? Like, how do we think about what we want to do, and how do we justify that, right? Moral philosophy going into ethics asks that question. The political theory to public policy thinks about what is the social organization that achieves the best outcome, best needing to be defined, right? So if you look at a lot of moral philosophers from, I don't know, Kant to Hume all the way through. And notice I only pick like really old guys. Their moral philosophy speaks to their political philosophy, right? Moral philosophy also speaks to practical ethics, right? Political theory, thinking about how do you organize society in a way, knowing what the foundation of human choice, and how do you organize society in a way that allows that human choice to actualize, speaks to public policy. What types of policies or rules or regulations do we want to make sure that that society is there? But it's also informed by the practical side of ethics, right? Why is economics in the middle? Why? Because I needed a place, and it was the only spot on the screen. I love that you said that because I have a fundamentally different view of economics, which we'll talk about later, but should I just give you a foreshadow? So economics used to be about supply and demand, right? Not really, but that's how we all saw it. Have you guys ever taken economics classes? Right, supply curve, demand curve, Lagrange multipliers, and all that stuff. So economics has changed and become a lot more explicit in what it does, meaning supply and demand is the result of this foundational question of what incentivizes people to do things, right? So it means what is the foundation of human choice, right? So it also says not only what is incentivizes, but what does that mean about human psychology such that we understand how they're making rational decisions, quote unquote. And from the social perspective, it's how do we organize society that allows for a maximization of something given our understanding of human choice, right? It also has a normative perspective of knowing this, how can we affect economic policy to ensure that or make the necessary tinkerings that allows incentivization to do this, right? So that's why it's in the middle. It kind of, depending on what type of economics you're doing, it plays a different role, right? But if you notice, all of these types of questions are fundamentally grounded in how are we making our decisions and how are we setting up our organization, our community, our society in such a way that people are going to make decisions in a way that speaks to who they are and what we collectively want to achieve, which should be an aggregate, maybe a reification, definitely, of what an individual wants. See that? Why is this an important slide? What happens at Yale Cancer Center? Are you guys a community, an organization, a collective of people? Within that collective, are there individuals who are making individual choices every day? Do we need to think about what incentivizes versus motivates people? Do we need to think about how they make decisions and what are the foundations of those decisions, whether it's rationality, emotionality, or something else? Right? Do we think about what are our policies or expectations such that we can reinforce those good decisions? We are, yeah. Like we're a little community. So we should be thinking about this, and then leaders should be thinking about how they situate this, right? Now, again, I'm not saying, just to be really clear, that to be an ethical leader, you need to know all of this. What I'm saying is when I create ethical leadership programs, this is what I consider in terms of how we do the training. That's really different, right? Okay, so now let's talk about leadership. So I really like Warren Bennis. If you don't know who he is, I recommend looking him up. He's done amazing things. I mean, he passed away, but he did amazing things. And what I really like about Warren Bennis is that he's not only descriptive, but he's normative. He doesn't talk about what leaders do, but he talks about what leaders should do. He also recognizes that leadership has a moral component to it, because being a leader doesn't mean being on top. It means having something to say that's worth saying and it's worth people listening to, right? There's there's a big difference between saying something and having something to say, right? Just because I'm here, let me talk about me for a sec. So I don't know if you guys can recognize this, but I am very introverted and I hate public speaking. However, I also feel that this is important things to talk about. So I have worked on myself, congratulations me, on being able to find ways to do this because I think it's worth doing, right? Which is very different than saying, well, I just want to be someone who performs and it doesn't matter what I say, right? Leaders are someone who has the capacity to translate a vision into reality, which means they work on themselves and they work on their communities, right? Whatever that community looks like. So how do they do this well? So these are really three different ways of saying the same thing. Leaders should not lead by position, but they should lead by persona. And I don't mean cult of personality here. So what do I mean by the difference between position and persona? What's the difference if someone says, I'm the VP, this is why you should listen to me, or I have reasons and I understand the complexity of this and this is why you should listen to me. Right? Don't push people to do something, draw them in to do it. Second is power versus authority. What's the difference between power versus authority? You guys are doctors, right? What do you have for patients? Do you have power over them or authority? Someone is going to say both, and it might be both. But power, if you think about power is standing by fear, right? Authority is standing by trust, right? A leader is much more persuasive when they're trusted as opposed to fear. Now, someone will tell me, okay, but Machiavelli said, better to be feared than loved if one cannot be both. Congratulations. You want to go that way? Have fun. I don't know if he was right there. Like that's cunning that allows to maintain power, but that's not going to work in like a cancer center. It's not going to work with patients, right? Okay, you may be nodding your head and you're like, maybe it will. They're super vulnerable. But in the long run, I don't know if that's if it speaks to the I want to be that type of person who coerces my patients. The other is authoritarian versus authoritative, right? So this speaks to like the way in which we demonstrate our authority, right? I'm sure you can imagine all in your head right now an authoritarian persona and what that would be like, right? An authoritative persona is very different, right? So when we think about leadership, like we haven't even got to capacities yet. We've kind of almost gotten to just posture. Like how does one stand as a leader in terms of being persuasive? And you notice I keep saying persuasive because we're all adults and we're not going to do things because we're told to do it. I mean, happily, but we will do things happily when we understand that this is a good, a right, a values-driven decision that speaks to also who I am and what I want to do, right? So persuasion is really the tool here. Okay, so let's put this together. We got ethics, we got leadership. What is ethical leadership? So first off, ethical leadership is what? I mean, it's on the screen. Anyone want to call out? Nope, no participation. Right. The ability of an individual to influence and guide others, right? That's the leadership part, right? But leadership towards what? Through ethical processes and procedures. By the way, that goes to the right, wrong, good, bad, right? Like what are our procedural values? How do we make decisions? Do those decisions speak to making sure that that we're not only communicating out, but listening in, right? Are we giving people the voice that they need? Are we giving the concerns to various stakeholders? How are we thinking about the ways in which we make decisions such that those decisions are either fair or just or good, or however you want to look at the right value, right? But not only what is our process, but are we trying to achieve something? Right? What is our vision? That's the 4 ethical goals. So based on, and those are going to be based on the individual and community's standard goals and values, right? So leadership is really a way of how we do things to get the results that we believe are right, good, what we want, what we that speaks to our identity and so forth. Now, if you notice, I put in this little, what is this thing called? JPEG, right? So it's taken from the 4V model of ethical leadership, which has vision, voice, values, but it has that big thing in the middle called virtue. So just so you know where I'm coming from immediately, probably should have said this in the beginning, but I see myself as a virtue ethicist, right? Have you guys ever heard of virtue ethicists before? Okay, that's fine. No one does. They're all like, what is that? And I'm like, I don't know. No, I'm serious. I do know. So virtue ethics, what it really does is, as opposed to consequentialists, deontologists, principalists, and all those other words, doesn't really ask, what is the best decision to make now? Or even rule consequentialists will say, what is the best decision to make now, such that if I always made this decision, it would be a positive sum versus a positive negative, right? But it's looking at individuals' decisions. Virtue ethics starts with the question of, how am I embedded in the community? What are my goals and aspirations and values vis-a-vis the community's goals and aspirations and values, such that as I live through a community, I can be my best self and improve society at the same time? It's a fundamentally different question, right? So one of the challenges people always ask me then is, okay, well, what does that mean for like the next decision I have to make? And I'm like, well, there's a lot of front work. No, but there are ways to think it through, which we'll get to towards the end of this talk. But the framing of the question is just thicker, right? It's not, what am I going to do now? Great. Like, what am I going to do next? Great. It's, who are we? Who am I? What do I want to achieve? What is my vision, and how can I actualize it? So we'll talk more about what a virtue is in a little bit more detail as well. So first, before I go into virtue and the theoretical background and the pedagogy, I got to give you my articles of faith, right? The reason why I'm calling them articles of faith is because funny. Other people might call them grounding premises. Most importantly, it makes me force myself to think about not only the validity of my argument, but the soundness of my argument. Do you know what the difference between validity of an argument and soundness of an argument is? Okay. By the way, just so you know, like, now we're getting into the clinical ethics side, the relation between validity and soundness will actually speak to patient competency, right? So if you think about this and then relate to, well, how do we determine if a patient's competent or not? Like, you'll see the relation. So the validity of an argument basically says that the conclusion is well grounded on the premises. Is the argument coherent, right? Soundness says, okay, but are the premises true? Right? Like, I can say, given my premises, this is the conclusion I'm coming with. And you're like, okay, no, that's deductive. Like, that makes sense, right? But you have to question the premises to see if even if the argument makes sense, is it a good argument or not? So here are my articles of faith. If you don't believe them, we can discuss, but not while I'm like at the end, because otherwise it'll take this off the rails. But if you do agree with them, then you'll see that this argument that I'm making is not only coherent, but really grounded in a fundamental understanding of like how we do things. So my first one is that people are generally inclined towards good, right? If people were generally inclined towards bad, like ethical leadership or ethics at all, we shouldn't even be talking about, right? We could talk about like what incentivizes people, how to make decisions, how to comply to certain things with relation to power and so forth. But like ethics doesn't work anymore, right? Now you may say people are generally inclined towards bad, but they can change, right? That still might work. But if you don't have at least the idea that good is something that we think is a good thing, it becomes very difficult to talk about ethics. I mean, I don't want to give you the data on like the number of sociopaths in the world and how successful they are, but I don't think the number of sociopaths in the world is like over 50%, right? Are they? Oh, please tell me they're not. They are? You're like, everyone's a sociopath? No. So if everyone's not a sociopath, then we can imagine that people might be generally inclined towards good, right? The second is certain components of moral living are akin to muscles, right? So Roy Baumeister like looked at this in terms of willpower. Others have looked at it in terms of attention. Others have looked at it even in terms of perception, right? But what this allows me to do is say that ethics and leadership are skills. They're not innate talents, or they're inclinations that you can work on to get better. So just like you can get better at your communication skills, or just like you can get better at your listening skills, you can get better at your decision-making skills, all speaking to what does it mean to be an ethical leader. The third is moral failings come in drips, not drops. What does that mean? I mean, it sounds good, but what does it mean? Yeah, it's a slippery slope of habit, right? Like very often what ends up happening to us, now I'm speaking generally, so there's always going to be like, that's not my experience, but so I'm speaking generally, is we'll do something small and we'll be like, but I'm a good person. That can't be so bad, right? So we'll be like, okay, the line's here. And they'll be like, but the line was there. I'm going to do this, right? And then once you get in the habit of doing something that is morally transgressive, and when I say morally transgressive, I mean against what you would have originally wanted to have done, right? I'm not being like external and normative here, right? Then you change your habits, right? Very rarely will I say, I want to eat so healthy, give me 16 cheesecakes. Like I'll have a slice and then eat another fork and then another one. And then I'm like, oh, I feel sick, right? It's the drips and then not the drops, right? Which means if you know that people do this, right? Sometimes we set up guardrails, but also then we have to think about, well, if people have moral quote unquote failings by drips, then we can also have moral quote unquote improvements by drips, right? We don't have to write people off. Right? And then given all of this, moral and leadership training is possible, right? So if we see these and we know that moral leadership training is possible, then we don't have to look for people who have personality, leadership personality, right? We can look for people who have something to say and give them the ability to lead with persona, to lead with authority, to lead in an authoritative way, right? It changes the way that we think about like the cult of personality or the character of a leader, to think about not just the performative act, but the substantive like depth behind that performative act, right? So again, Warren Bennett, just because he's amazing, true leaders are not born, but they're made, and not made as much by others as by themselves. So we can talk about what that means. But that, of course, is not all. So when he says, not as much as by others, but by themselves, what he really means is, let me put it this way. You guys teach in one capacity or another, right? So do you know that the skills of teaching and the skills of learning are different? Which means the way you teach can't be the same way you learn, because you're not thinking about how I would learn it. So therefore, that's how I would teach it, because my learning is just like their learning. But you have to think about who you're trying to teach, where they're at, and how they would learn, such that they can actually learn from your presentation, not because you're just dumping knowledge into their brain. So here, leadership and ethics is not a matter of people teaching it to you, right? It's a matter of you learning it, which means teachers have to give opportunities and set up an environment that the skills and the values and the content can be adhered and embodied. I can't dump it onto you, right? So that's really what we're talking about here, right? That's the type of educational background. But before we even get to the educational background, let's think about the theoretical fields. Oh, well, let me do the virtue first. So when I talk about being a virtue ethicist, you're like, okay, well, what is a virtue? Like, that sounds great. But let's break it down into its component parts. First off, tell me what you think about this definition. And two, tell me how you think this definition speaks to moral training and ethical leadership, both as in terms of an individual and in terms of an organization. Tell me if this speaks to you. So a virtue is an acquired, active, persisting tendency, right, to act reliably, a habit, how we do things, on a regular basis, towards accomplishing a certain goal, right? It's not a habit towards nothing, right? Has an ethical part to it. For having certain reasons for doing so. You've thought this through, right? In a way that informs and expresses a person's identity. Do I want to be the type of person that does this or wants this, right? Which is developed through habituation within a community, right? Meaning like you've practiced it so it becomes like a second nature to you, right? And by which the person becomes more intelligent in the nuances of acting, because life is complicated and not every solution has the exact same answer. Requires less effort to act. Because you've done it so well, you're now actually good at it, and it takes less time to figure out. But you still aspire to improve through continual performance, because you don't just rest on your morals, but you're continually trying to better yourself. What do you guys think about that definition? Does it speak to you? Does it speak to how we trained, what are they called? Entrusted capabilities in medical school? Isn't it? Something like that? Oh, okay, fine. Right? Meaning like when you think about medical competencies and you're like, all right, we're going to train you to be a surgeon, right? So would you want a surgeon to have like, to be reliable in how they act? Would you want them to accomplish a certain goal? Meaning like cut well, to get out, like don't cut an arm off. I mean, unless you have to. They have certain reasons to do so, meaning like they're not just cutting because it's fun, but because it's necessary. In a way that expresses a person's identity. Doesn't that speak to professional identity formation, right? Isn't it developed through habituation in the community? How do we do medical education and training, right? Don't you want the surgeon to be more intelligent in the nuances of their surgery? Don't you want them to have less effort as they get better? Meaning they open up space to see more than just like what they're working on so that they can have a better understanding of the patient and their care. But they aspire to continually perform better. Like, doesn't that speak to what like a medical professional is looking like? Right? So virtue doesn't have to simply be, well, how do I be more ethical now? It's how do I be more myself, knowing that ethics isn't just, what did we call it? The lemon in the Diet Coke. It's really the what permeates our way of being such that we act and be in a way that demonstrates excellence, right? So ethical leaders, because they're working by persuasion, which means not only to talk to you, but to demonstrate and speak and communicate through action, because they're working through their persona and they're working authoritatively because they're an authority and not coercive with power, they're developing these virtues in themselves and facilitating those virtues in their people, right? Like that's what I want to find in a leader. Like I want someone who not only shows me what I can be because they can be that way, but also helps me be that way. As opposed to saying, well, I got here, figure it out yourself, right? So how do we train this? That seems like a lot. How many of you guys think that's a lot of work? I mean, I think it's a lot of work. It's a lot of work, right? All right, so how do we do this? Like, how do we think this through, right? So like I look at lenses through economic psychology and political science. You can look at it through anthropology and sociology. You can look at it through literature and so forth, and we'll talk about that. But this is how I'm going. So first is I look at the relationship. I won't go through all of this because it seems like time is, I won't go through all of this, but in terms of the psychology, I'm trying to think about what motivates, not what incentivizes, but what motivates, right? And what makes people think about how they're making these decisions. So we have three different models that I look at in terms of looking at the motivation. The first is, how does the environment affect what like makes things salient in terms of what we do and why we do it, right? That speaks to the social intuitionist model of people make decisions because they see what is going on around them. They make a quick reaction to what's going on around them, and then they rationalize. Like that has to be right because that's what people are doing. You have the Kohlberg's approach, which is, nope, people develop a certain form of maturity, or first they're very egoistic, then they're very conventional, meaning like they follow the rules. Then they realize that rules are guidelines, and there sometimes might be exceptions not to do what they want despite the rules, but because the rules or the guidelines are trying to achieve certain things, both goals-wise and values-wise, that there may need to be an exception because we need to try to achieve something, not simply comply with the rule, right? Like, could you imagine saying, I can't prescribe something off-label, even if I know it helps you, because there might be a rule that I have to follow what the label says, right? Now, I don't want to get into the pharmaceutical aspects of that, but I kind of said that because you were there. And then there's the learning side of, okay, well, how do we do this? Like, what does learning mean? It's active. It's gained not simply through reading, but through social engagement. And the knowledge is personal. Don't, if you get anything else, don't think of knowledge like money. Meaning, don't say, I have knowledge, I put it in my pocket, and I can use it when I need to. Think of knowledge as tools, meaning like when I'm working and acting or living in life, I need tools to help me do that well. Knowledge makes me more able to do things, as opposed to the more knowledge I have, the wealthier I am. And the more I use it, the more I spend it. Like, that's not how it works. Knowledge is personal. Now, economics. So the way I think about economics is not on the motivation side, but on the incentivization side. Right? How many of you guys have ever had a conflict between your motivation and your incentivization? Would you like to give you an example, or you guys got it? I mean, like, I really want to treat this patient, but I am incentivized to spend my time elsewhere. Or I really want to tackle this problem, but it's maybe important, but it's not urgent because I really have to fix this, right? So we need to think about what incentivizes us and how to align our motivations and our incentivizations, right? Like, I know in academic medicine and in academia in general, we have something called, like, we publish, we do clinical care, and we have service, being on committees. How many of you guys love being on committees? How many of you guys are motivated to change the culture here and see the committees are an important part of that, but you just don't have the time? Right? How do you align your motivations and your incentivization such that they're like, not only they're not in conflict, but they allow you to do what you want to do, right? So now we also have to think about, when we think about incentivizations, the relationships between rights and duties and economics. So there's two different theories on this. There's the welfare economics, which really looks at rights and duties as like really high preferences. Right? Like, so you'll see this in law and economics a lot in terms of they'll look at population benefit without really considering like rights and duties as a constraint, like as a constraint. Another way of looking at it is through a Kantian ethics lens, which means rights and duties are constraints to the algorithm as opposed, or the maximization function, as opposed to just high preferences that you have to consider, right? Which means, like, here, I'll just give a simple example. Sometimes when we override, or when we think about the relationship between patient autonomy and beneficence, which I don't want to say creates ethical dilemmas, that's a whole different talk. But if you do see them as an ethical dilemma, then you might say, well, patient autonomy is not a right or our duty, but it's just a really high preference, such that if the beneficence was so high, then we might be able to override it for the sake of beneficence, right? We don't actually do that in medicine, but like, right? But you could see how that might work in other areas, where a Kantian ethics would say, no. Like, you can look at all of the beneficent choices you have, but once it hits patient autonomy, then it becomes a constraint on the function, right? And that variable no longer works. So when you look at economics here, it's about incentivizations and what are the constraints of that incentivization. And then with regards to political theory, it thinks out, okay, where are we coming from? How do we organize ourselves? And how do we look at creating this organization such that it can actually speak to our goals and values and our idea of human nature? Now, I'm not going to talk about all of these books, but the two things that you should recognize really quickly is both Adam Smith and Karl Marx wrote very, what do we want to call them? Influential books in political economy. After they wrote I wish people read them, because if they did, they'd see that they're very influential books on either ethical theory or theory of personal identity. So Marx's Economic and Philosophic Manuscripts of 1844 talks about the relationship between a person and their work, and how they become alienated by against the product of their work, because they don't see their work as a product of who they are. They see it then as something separate and then competing with who they are. That then caused him to then think about, okay, well, how do we create a society that mitigates, prevents, and ameliorates that type of alienation, right? In Smith's theory of moral sentiments thought about, okay, how do people interact with each other in an ethical way? So he thought about, okay, well, what really happens through a concept called sympathy is I imagine what you would want, and then I would feel that way, and then try to provide something to you, right? He then said, oh, well, that also works in political economy, because the butcher, the baker, and the candlestick maker don't make what they want. They make what they think the consumer might want, because they imagine someone else's wants and then provide to fill that need based on what they want, right? So they're using their view of how people make decisions and how people relate with each other to then create society. Rawls and Nozick really are saying, okay, but what's the fundamental structure? Is the structure a form of contract, like a veil of ignorance of we need to set up a structure and then act within it? Or is it more, let's just be nice and say free flowing and then figure out how people construct their own institutions over time, right? So now let's get to the educational schema, right? Or schemata, because there's more than one. So how do we do this? How do we make knowledge personal? How do we make it embodied? How do we look at the environmental and also the individual like the environmental factors and the individual competencies? So it's not simply just a matter of like creating case studies, right? But it's a matter of thinking, all right, well, how do these competencies work in terms of habituation or creating habits and so forth, and how do they become part of who we are? So the first person I rely on is Alistair McIntyre, right? And he looks at how practices need to be embedded, or virtues need to be embedded within practice. The practice needs to be tied to a narrative or a tradition or a way to explain how those practices make sense. And the practices and the narratives have to be like part of a bigger reason why, or almost like a worldview, right? So when you think about, for example, in medicine or the culture of Yale Cancer Center, you think about, okay, how do I get people to do things? How do those do things, quote unquote, things that people are doing make sense? And what does it speak to who we are, why we're here as physicians, as a values and mission driven hospital, as like the profession of medicine, right? Like, how does this work, right? Next, I'll look to Martha Nussbaum. So Martha Nussbaum says moral education requires narrative not in the same type that Alistair McIntyre says, but what she really focuses on is the relationship between ethics and literature. She says you can't understand the complexity of human nature through the sterile like formula of an ethics expression. Like make sure an ethical decision is such that you can it will be a product of a self-legislating will, right? Great. Like, I have no idea what that means. I mean, I do because I'm an ethicist, but I wouldn't expect anyone to know what that means or even where it's from, right? But if you read a book on the complex interpersonal like relationships between characters, and you know how they work, and you know how they think, and you know how you see their lives, you could, through vicarious experience, think, what would I do in that situation? What could they do in that situation? Meaning, make your moral philosophy or make your ethical decision-making thick. Don't say, what would you do in a conflict between beneficence and patient autonomy? Who is this patient? What do they want? Where are they coming from? Who are you? Like, what biases are you bringing into the room? What are your tensions or pressures organization like? Build this story, because the more facts you have or components you have, the better able you are to think about a right decision, act out a right decision, and be effective. Right. And the third is Mary Gentile, who is a good friend of mine, and she's amazing. She recognizes very, very quickly that the relationship between how we analyze ethics and how we act ethically are sometimes, often, not the same. Right. Almost going back to Jonathan Haidt's view of okay, well, people will just do things and then rationalize it afterwards, right? She tells a great story of how she would do this consulting gig at Columbia Business School. And one of the things that came up was someone asked, what is the point of ethics classes? And the flippant yet pithy student said, well, it allows me to do what I want, but then justify it with moral language. And we're like, yes, we win. So she's like, all right, well, don't ask what should you do. It doesn't work. It's externalized. Ask, if you are going to do something, if you are going to act on your values, how would you do that effectively? Tie implementation to awareness and analysis. So fine, you have these three educational schemata. You have what we want people to do have to be embedded in this like larger frame, right? How we see what we want people to do have to be embedded in a larger story. And when we want them to do it, don't think about, well, what would you do in the abstract? Say, what would you do given who you are now? Right? That's the types of questions we need to ask, and that's the types of thinking we need to train people to do. Right? Now, I'm talking about people, so how do leaders look at that? Right? Well, leaders should say, all right, well, that's what I want to cultivate in people. But how do I set that environment? Is how do I make it easier for people to ask those types of questions, both in their training and in their everyday life? Because if you have a training that is not reinforced in how they make decisions in practice, the training is worthless, right? Like, can you imagine taking a class and then stepping out of the class and everything you learned in that class made sense in the class and has no relevance to your point? It's like going to first 2 years of medical school and then going into clerkships. I'm kidding. Right? So we created something at the Aspen Ethical Leadership Program. By the way, I don't know if you recognize that's me. Okay, called the AAA framework. So we really focused on, okay, what is awareness, what is analysis, and what is action, right? The first thing that we wanted to do in our awareness step is to recognize that people have gut reactions. And when you don't call out your gut reaction, a couple of things happen. One, you're pretending that you're objective. Two, you will have ironic processing, which means if I tell you, I do this all the time. If I tell you not to think of white rabbits, what's the first thing you're going to think of? Hopefully a white rabbit. If you're like a pink bunny, and I'm like, okay, I lose. But your gut reaction really allows you to situate yourself from where you are, right? Then you start thinking about, okay, what are the values in conflict? And then as awareness turns into analysis, you're like, who are the stakeholders? This isn't only my view, right? Who are the other people involved? Start creating the story. What facts are salient? What do I need to consider? What are the choices available to me? Don't be framed by your process. Think about your goals and think about the choices to allow yourself to be as creative as possible. And then in this recursive process, as you start thinking about your implementation will feed back into awareness and analysis. Awareness and analysis. Because in ethics, we say ought implies can. I love logic. It's like so clear in the math, and then in real life, it's not clear at all. Ought implies can, which means cannot implies ought not. If A implies B, not B implies not A, right? So if you go to an action step and you're like, well, we can't do this, then don't say, but we should, because that doesn't work. Don't go to, well, we should do something. I tried. Remember in the beginning of this talk, I tried, and effort is all that matters. It's, I want this. There's got to be another way. Right? So that's how we set it up. We set it up through cases. We set it up through environment. We set it up through somewhat didactic to introduce ideas, to prime people to think about it, to be engaged in it, to debrief in it. And then we try to make it as not overwhelming, but as inclusive as possible, such that we create an environment that allows people to develop these skills, because these skills and these competencies, the biggest challenge to this is because it speaks to who we are, we're sometimes afraid to be vulnerable. And this is my last leadership lesson to you. The greatest power a leader can have, and I don't mean power in terms of like coercion, but I mean power in terms of like what gives them the ability to be persuasive, is their ability to be vulnerable. This slide I put for a reason, because it looks like ethical leadership is, I'm thinking it's the red little guy, is away from the people and different from the people. And sometimes we think about it this way, but it's not. ethical leadership is dirty work. And what I mean by dirty work, I mean is you get your hands dirty. You see the problem. You engage in people. You think about the issues. You don't stand aside on moral high ground, right? So doing this means that moral leaders are those who work on themselves and facilitate an environment that others can work on themselves as well. Right, I want to get to my best slide. Any questions? By the way, that's me. Yeah. So you can clap if you want. We have time for questions?
Yeah. You can see, I can also check and see if there are.
You guys have questions, or was that entirely clear? Yeah. Oh, comment. Okay, love it. Mm-hmm.
Is that like this, we did double standards.
Mm-hmm.
And that echoes today's reality.
Mhm.
That's the biggest dilemma. That's why I said no, because no matter what is applied.
I don't disagree with you at all. I don't have deference to people because they wrote a book. Not that I'm always giving ad hominem arguments of like, he wrote a great book, but he's a horrible person. Because I'm so great. Like that's not what I'm saying. What I'm saying is I'll take good ideas from where they come and I'll incorporate it in a way that works for now. There are a lot of things wrong with a lot of moral philosophers and leaders in the past. But there are some insights that they had that we can still work with. So that's yeah.
I'll ask a question that I asked you last week.
Sure.
So, if we aspire to ethical leadership, how do we select that? So our leadership historically has been based on CVs and publications and grants and like, there's no place for like ethics on my CV. So how do we select that?
Yeah, I'll give you a different answer than I gave you last time. 'Cause last time I'm like, well, like, give me your process now and let's pick it apart. But I'll say something different this time. I'll say a lot of times what we like to do is we say this is what we want. We don't know what it is, so we'll say that this is a proxy for this, right? Rhetorically, I do this all the time, right? I'm sure all you guys do as well. I don't know this subject, but I know a lot about avocado farming. So I'm going to tell you how this subject is like avocado farming, and I'm going to talk about avocado farming, knowing that I'm really talking about that, which I have no idea what it is. But now I look like such an expert because I put it in a simple frame and a paradigm, right? So a lot of times when we think about ethical leadership, we're like, okay, I don't know what that means. So let me look at how have they been successful? Have they been persuasive in attracting money? Have they been successful in how they've grown their organization? Have they been successful in other areas? So we're like, okay, that's a good enough proxy. Let's just take that, right? And one of the reasons why we don't know what ethical leadership is because we don't operationalize the definition, but we have all the tools, right? If we say this is our organization's goals, even if they're in conflict, but these are all of their goals. This is our mission. This is our vision. These are our values, and not simply just conceptual values, but what is the value and concept? What is a behavioral definition? What are the questions that we ask when we're making decisions such that we're incorporating that value? And what is that, when we ask that question, who are we potentially excluding when we act on that value? If you operationalize it, then you say, what type of person are we looking for? Are we looking for someone who is aligned with our vision? Is it someone who understands and speaks our values? Is it someone who is aligned with our goals? And then we say, all right, we can do somewhat of understanding that people are consistent, so their past will relate to their future, right? But I think we need to think more of, okay, well, how do we test them to do it? We're so nervous of testing leaders because we're like, they're going to be our boss. Like, what happens if the interview doesn't go well and then I have a consequence, right? But if the structure is, don't talk to me about this, show me how you do it. I think that's a really good way to interview people. Like, it's actually becoming more popular in corporate world. Like the performative interviews are really are becoming seen as a better way to evaluate potential candidates, because every culture is somewhat different. Values mean different things. People can grow over time. So you don't want to simply just look at the past. Like, you want someone for a specific job, know what the job is, and then put them in there and see how it is. Right? That's easier said than done, but that doesn't mean it's not impossible. Yeah. Yeah. Oh, can I?
Maybe we'll do one last question.
Yeah.
Can I just follow up on that?
Yeah.
I actually really like the idea of building leadership.
Yeah.
And in terms of testing that or how that could be a criteria is where I'm somewhat. But I really 100% political leaders, fabulous leaders, but aspire to.
So how do you test vulnerability of leaders? So part of that's the onus on the interviewers to be courageous, right? I mean, what I like to do when I interview people, both up and down, like I'm kind of super bold in ways that it's not reckless, but I know what my risk tolerance is, right? I get real with people very quickly. Like I'll have a meeting with someone and they'll be like a CEO of a company, and I'll be like, all right, I have 4 kids. How many kids do you have? Like, because we're talking about kids. And I'll be like, how hard is it to be a parent? And they're like, what? I'm like, how hard is it? Like, what do you do? I'll tell you how hard it is for me, but I want to hear you first, you know? And that could be off-putting, but I need to know, like, is there a shell? Is there a wall? Like when people need to see a person as opposed to a position, is there a person there willing to be seen? Right? I don't want to put the onus on the search committee entirely for that. But you gotta see how to do it. You have to test it, you know? So, and you can push back because not every situation is the same, but it's a matter of finding what are all the available choices for you and wanting that and seeing which ones work. Remember, cannot implies ought not, but something can, you know? Can I say one last thing? Because it's a rant.
Yeah.
A lot of medical schools are doing NMIs, right? In terms of like, okay, you got 6 minutes. Like you had a challenging situation. How did you recover from it? What decision did you make? What did you learn from it? All right. So I used to always push back on this, on saying, like, first off, how much of the environment affected the choice that you make? How much are you coloring the story because you know there needs to be a positive outcome? And how much does the fact that this is an interview and you want something from me influence how you're describing this scenario, right? The ritual that we've created in interviewing already makes it artificial. So you have to find ways to break the artificiality of it, right? Okay, thank you guys.
Yeah, thank you, Dr. Bedzow.
If you guys have other questions or comments or anything, I'll be here for a little bit, but feel free to email me. I'm readily available.
Email me to get his email, but really wonderful. Thank you.